Welcome to today's eye review session. My name is Yejun, a second-year medical student at the University of Calgary. Our team will present to you today the keratoconjunctivitis sicca and other ophthalmic changes in rheumatoid arthritis as a link between ophthalmology and rheumatology. Rheumatoid arthritis is characterized by a systematic inflammation of the joints, and it can also have extra-articular manifestations, meaning symptoms outside the joints can occur characteristically with RA. And one of the organs where RA has this effect is the eyes. And specifically, eyes will develop disorders of the sclera, episclera, as well as tear production, so the lacrimal gland and their ducts. So rheumatoid arthritis, as explained before, is a systemic autoimmune disease characterized by polyarthritis. It is generally bilateral and symmetric, and usually the joints present with pain, stiffness, difficulty moving them, and the loss of the range of motion with the joints. And generally, when a patient has rheumatoid arthritis, on investigation, they're associated with rheumatoid factors, or RF, and anti-CCP, or anti-cyclic citrullinated peptide antibodies, as well as inflammatory mediators, IL-1, IL-2, and IL-6. However, that does not mean rheumatoid arthritis has to occur with the presence of RF or anti-CCP. This rheumatoid arthritis, as we will learn in the subsequent slides, is frequently observed with extra-articular manifestations. The criteria for diagnosing rheumatoid arthritis exists, and it's created by American College of Rheumatology and the European League Against Rheumatism. And the criteria involves the inflammatory arthritis, how many joints are involved, and the RF and the CCP testing that we talked about, and the acute phase reactants, CRP and the ESR, and the duration of the symptoms. There has to be caution, though, that rheumatoid arthritis can be similar in presentation with other inflammatory diseases like psoriatic arthritis, acute viral polyarthritis, polyarticular gout, and lupus. And if you take a look at this table here, there are if you count how many joints there are, as well as the serology, a rheumatoid factor, and the anti-CCP antibodies, acute phase reactants, and the duration of symptoms, you can assign a score to each of the criteria, add them up. If it's 6 or above out of 10, this is called definite rheumatoid arthritis. So finally, here we are at the extra-articular manifestations of rheumatoid arthritis. What exactly are there? Now, before I delve into this, this slide does not mean that all the patients with rheumatoid arthritis have all these symptoms. This is just some of the symptoms that may be seen with this disease, and these manifestations do not have to be present for the patient to be diagnosed as rheumatoid arthritis. But that being said, some of the extra-articular manifestations include some of the systemic and B symptoms like fatigue, malaise, poor appetite, fever, and weight changes. And on the skin, there can be nodules, especially on the side of your elbow or your knee extensor surfaces, and the periarticular areas. The pressure areas, where the areas and especially the joint parts that receive a lot of pressure, and on tendons. And also uniquely, the nodules can form on the lungs, heart, and the brain. In terms of respiration, you can have chest pain and dyspnea, as well as ILD, interstitial lung disease. The heart can develop arrhythmia and pericarditis, or the inflammation of the sac that envelops the heart. Neurologic symptoms include carpal tunnel syndrome, typically the tight retinaculum on your wrist. Paresthesia, which is a sense of tingling at your peripheral limbs. Thenar weakness, which is the muscle at the base of your thumb, and also worse with activity or at night. The small vessel disease can include gangrenes, rotting away of the flesh in extreme cases. Because of the inflammation, there is inadequate circulation around the periphery of the body. Specifically in the eyes, they can develop scleritis and episcleritis, the inflammation of the outer layers covering the eyes. And also the eyes can develop Sjogren's syndrome, which is dryness. So specifically, there's keratoconjunctivitis sicca. Sjogren's also implies dry mouth. And keratoconjunctivitis sicca describes eyelids sticking together because of dryness. And this dryness means the lubrication system has failed as well. So that every time you blink, the eyelids leave behind scleral and corneal abrasions, little scratches that can be very irritating and painful. The non-pharmacological treatment to arthritis includes a simple and healthy lifestyle, such as rest, exercising, physiotherapy is part of it, as well as occupational therapy. It goes to show that you should eat right. It never hurts to receive nutritional counseling. And also symptomatic treatments for all those articular as well as the extra-articular symptoms. And because the circulation is very important for the body, the interventions for cardiovascular if the arrhythmia is present. And another important point for arthritis is to screen for and treat the osteoporosis. This is because the chronic inflammation associated with RA, as well as the vascular insufficiencies that results from that, are very harmful to the bone. And also the treatment for arthritis, which can be corticosteroid drugs, all contribute to the breakdown of the bones and the weakness and the decline of the bone density. Pharmacological treatments for rheumatoid arthritis includes the famous DMARD, or the disease-modifying anti-rheumatic drugs. The example of that is hydroxychloroquine. But beware of the ophthalmologic vulnerability or the side effect of this drug. This can cause retinopathy, overall decreased color vision, visual field defect, and this characteristic bullseye maculopathy. Look at this target-shaped pattern shown on the two fundoscopy pictures on the right. Sulfasalazine and methotrexate are also other types of DMARD. Now, biologic DMARDs include the TNF-alpha inhibitors, infliximab, and adalimumab. These are synthetic antibodies targeted specifically to our needs. We have briefly taken a look at what rheumatoid arthritis is as a disease and how it could manifest in different parts of the body. Next time, we will draw more specific links with the eye and the RA, and also learn the signs and symptoms as well as how to treat it.